Care Alliance has been a fixture in the Cleveland community for over 35 years, providing health care to residents in the Cleveland area. So we welcome President and CEO Dr. Claude Jones to the show. Dr. Jones, how are you today?
I'm doing great. Thanks for having me.
Yeah, we're glad to have you. I tell you what, I've been around a long time, and 35 years you guys have been doing this, and I don't know much about Care Alliance. But tell us a little bit about it.
Okay, so we're a community health center. We have two clinics in the greater Cleveland area, one on Central Avenue and one on St. Clair Avenue. As you mentioned, we've been providing care in this community for over 35 years with a heavy focus on the homeless population. Actually, when we first started, we started out as a healthcare center for the homeless. So that continues to be part of our mission.
So how much of the care you give is emergency versus just lifestyle and helping people get healthy once again?
Okay, so most of what we do is, revolves around primary care. So we have internal medicine, family medicine, pediatrics, women's health, OBGYN. We also have behavioral health services, and we have dental services as well. So we try to make sure we get out in the community, make sure we educate, make sure individuals follow up on their appointments, and do everything we can to inform and educate our community.
Yeah, in the days of the virus, it's very difficult to get a face-to-face with a doctor. Like I've talked to a couple doctors, and it's been almost the same way you and I are talking right now. And folks on the street, they aren't lucky enough to have a television or watch a television show, but still, I'd like to know, how is it to walk into it? Can they just walk in to see you? Are there precautions? How do you handle that?
Right. So we're still encouraging patients to walk in for face-to-face visits. We find that this is a great way for us to continue to deliver care. But we've also implemented our telemedicine platform, where we're able to communicate with patients electronically and also virtual visits as well. So we found this as a great way to continue to create access for those individuals who can't make it into the clinic. So we want to make sure we continue to promote that.
Yeah, so now that more people know about it, I know more about it, is there something we can do on the outside to help the clinic?
Just continue to promote the Care Alliance name. What we do in the community. Our mission, which is to provide comprehensive, quality behavioral health, medical, and dental services to those who need the most, regardless of ability to pay. Just keep spreading the word for us.
Yeah, I tell you, really, if somebody comes in with a serious problem, then do you direct them to the next stop, like maybe a hospital or another clinic, or how does that work?
Right. So we want to always make sure we're developing partnerships with our neighboring hospitals and clinics. So the Cleveland Clinic has been a great partner with us, Metro Health, University Hospitals as well. So we have memorandums of understanding in place with these hospitals, where we can send our patients in case there's an emergency, and also provide that follow-up care if needed.
Well, thank you, Dr. Jones. Care Alliance, I learned a lot about it. I hope everyone else did. And if there's any way we can help, just holler. And we welcome you back to the show anytime you want to come.
Okay, thanks for having me.
Thank you, Dr. Jones.
Stay safe.
Yes, stay safe.